How long is the liver transplant waiting list really? Imagine waiting for a life-saving gift that could come at any moment but might take months or even longer. That's what many patients face when waiting for a liver transplant. The length of the waiting list varies a lot depending on several factors. In the United States, as of late 2020 and early 2025, about 9,000 to 9,100 people are actively waiting for a liver transplant. This is part of a larger list that includes over 100,000 people waiting for all types of organ transplants. Liver candidates make up roughly 9% of that total. The time you wait depends mainly on your Model 4 and stage liver disease score, or MELD score. This score measures how severe your liver disease is, with higher scores indicating more urgent need. Patients with very high MELD scores often get priority, but even those with scores between 22 and 27 are experiencing longer waits than in previous years. This is because the demand for organs is increasing while the number of available livers remains limited. Waiting times can range from just a few weeks to several months or more. If you live in a region with fewer organs available, your wait might be longer. Some regions have higher dropout rates, meaning more patients drop out of the list because of worsening health or death. For example, in some areas, dropout rates have increased from around 53% to over 64%. The aging population of liver transplant candidates also affects wait times, as nearly half of the patients are over 60 years old. Additionally, more people are being diagnosed with non-alcoholic steatohepatitis, a liver condition that can also influence how long someone waits. Organ availability plays a big role. The United States performs about 8,000 to 9,000 liver transplants each year, including some from living donors. Living donor transplants can help reduce wait times because a healthy person donates a part of their liver, which then regenerates in both the donor and recipient. Despite these options, about 41 to 46% of patients on the list drop out before they get a transplant. Many of these patients experience worsening liver function or develop complications like liver cancer during the wait. For some, especially those with very urgent needs or acute liver failure, the wait might be shorter. But for many others, it can take several months or longer. During this time, close medical supervision is essential. Patients often need treatment to manage symptoms and prevent disease progression. For those with liver cancer, timely transplantation is especially critical because delays can affect survival chances. In the context of liver health and liver cancer, waiting times are a significant concern. Advanced liver disease and liver cancer are common reasons for needing a transplant. The longer the wait, the higher the risk of health deterioration, which can impact eligibility for transplant. That's why managing liver disease carefully and monitoring for cancer progression are vital while on the waiting list. In summary, the liver transplant waiting list is quite large and growing. Many patients wait months or even longer, and nearly half may drop out because their condition worsens. Living donor transplants are an important way to help some patients get a quicker chance at a new liver. If you or someone you know is on this list, it's essential to stay in close contact with healthcare providers and follow medical advice to optimize chances of a successful transplant. Always remember to consult with medical professionals for personalized guidance and support during this challenging time.